1 in 3 people will have cancer in their lifetime. It's a terrifying stat. Cancer is the second leading cause of death across the United States. But did you know many cancers can actually be prevented or even caught early?
So February is National Cancer Prevention Month, and joining us on Leading SA to explain all this is Dr. Shraddha Dalwadi, a breast radiation oncologist at UT Health San Antonio. Good morning, doctor. Thank you so much for taking the time to join us.
Good morning. Thank you for having me.
So right off the bat, doctor, what does the problem look like locally?
So cancer rates here in San Antonio and in South Texas are similar to what we see nationwide. But what's interesting is that we are seeing disproportionately higher rates of liver, stomach, and cervical cancer. We are also seeing issues related to access to care, meaning we sometimes see neglected cancers because patients can't get in to get treated early or screened early, and otherwise preventable cancers by vaccines or different screening mechanisms that we have.
Okay, in the recent weeks, we've seen some studies or data saying that younger people are getting diagnosed with cancer. Why is that? And are you guys seeing that locally as well?
Yes, we're seeing that across the board. So the question about why younger people are being diagnosed with cancer, it's thought to be due to the changing diet patterns and exercise patterns that we see in modern times. Also, genetic risk factors are probably at play here. We're also seeing things like HPV-related malignancies continue to rise as smoking-related cancers going down. So what we're seeing is that cancer rates in general are changing, and we're discovering now that younger people are being diagnosed as well.
Doctor, you mentioned the changing rate of diet and exercise. I have to imagine that means that we're seeing lower rates of people dieting properly and exercising. And that leads us to the question of preventability. How can people watching this right now, a lot of families, how can they prevent cancer?
So you can avoid alcohol and tobacco use as much as possible because those have been clearly linked to certain cancers. Eating a healthy diet, balancing fats, proteins, and carbs, protecting your skin when you're out in the sun. You should stay up to date on vaccines recommended by your primary care doctor. So hepatitis B vaccine and HPV vaccine actually prevent liver and cervical cancer and some head and neck cancers. You should continue to follow closely with your primary care doctors because they know you best. So they can advise you about which cancer screenings are important for you and how you can watch out for symptoms of cancer.
Okay, you're talking about screening. So what screenings should people be getting to help with the early detection?
So there's many different types of screenings. And your personal recommendation will be based on whether you're a man or a woman and whether or not you have a family history of cancer or other risk factors for cancer. So talk to your doctor, but in general, for breast cancer, we recommend mammograms. For cervical cancer, we recommend Pap screening. Colorectal cancer, colonoscopy. Although there are different other options if you're not a candidate for colonoscopy. For lung cancer, certain patients may be candidates for low-dose CT scans.
And obviously screening is so important, but there's a big question of when should we get started? Is it ever too early to start getting these screenings?
Yes, it is sometimes too early to begin screenings. It's a risk versus benefit ratio. Again, talk to your doctor about it because it really depends on your individual history and risk factors. For women, cervical cancer screening generally begins at age 21. Mammograms begin at age 40. Colonoscopies generally begin at age 45, but some patients we can consider doing it earlier in. Lung cancer for certain individuals, screening can begin at age 50. For men, prostate cancer screening can begin at age 50, so talk to your doctor about that.
Okay, so earlier you addressed younger people being diagnosed with cancer. It could be linked to diet and exercise, but also we're just more aware and people are more proactive in getting screened? Could that also be why we're seeing a higher rate of younger people being diagnosed with cancer?
It could be contributing. So the fact that patients are getting their mammograms on time leads us to diagnose cancer at an earlier and a curable part of their cancer journey. So it is possible that just getting screening in itself is leading to a higher detection rate of cancer. But it's interesting because the patterns we are seeing are probably beyond that. So we're still learning more and more every day. Until then, the best thing I think people can do is to be an active participant in their healthcare. Try to keep following up with your doctor, and you know your body best. So if you notice something wrong, try to get it evaluated.
And you're a breast radiation oncologist. Obviously, breast cancer is super prevalent in and around San Antonio. What are some of the risks?
So two of the most common risk factors are not preventable, just getting older and being a woman. Obesity or being overweight can be associated with breast cancer. A family history of breast cancer or ovarian cancer makes us think about genetic causes that may be related to breast cancer. And being pregnant fewer times or later in life is also related to breast cancer.
Are you guys also seeing a higher rate of younger women being diagnosed with breast cancer as well?
It's interesting. We do see quite a few younger women being diagnosed with breast cancer here. And the thought is that it's most likely related to genetic causes. So for certain individuals, we recommend genetic screening.
Well, Dr. Dalwadi, thank you so much for starting your morning with us. Anyone who has any questions, comments, concerns, any further questions, we have all this information coming up on ksat.com through the morning.
Thank you for watching KSAT. If you're watching on YouTube, be sure to like and subscribe so that you can stay up to date with San Antonio's latest news and weather.